The December 18th, 2018 meeting of the Ways and Means Committee will now come to order. Will the clerk please call the roll?
Mr. Ansello. Here. Mr. Baroff. Here. Mrs. Conley. Here. Chairman Delahanty.
Here.
Mrs. Draw.
Here.
Mr. Felder. Here. Ms. Cayley. Mr. Mafucci.
Here.
Mr. Marinetti is excused. Mr. Morelli. Here. Mr. Rockow is excused. President Carbone. Here. I called you. I marked you.
And with that, will Legislator Cayley please lead us in the Pledge of Allegiance? Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. All right. Are there any speakers signed up for the public forum?
Yes, we have 6 speakers signed up. I will call up 3 at a time. When I call your name, please come forward to the podium. You have 2 minutes in which to address the committee, and we just ask you please conclude your remarks when the buzzer sounds. Our first 3 speakers are Pia Stamp, Cynthia Tolman, and Jamie Edwards.
My name is Pia Stampe, and I'm a physical therapist and owner of Step by Step Developmental Services, and I'm again addressing you about early intervention. I'll be brief this time. We've been here several times, a lot of us. First of all, I would like to thank you for your help in averting the immediate crisis with service coordination. As a provider, I remain concerned that families are not receiving the help they need with the current temporary fix. Let me just bring to your attention that there are currently 94 children on the waiting list in Monroe County for early intervention services. These children are in 20 different zip codes. More than half of these children are waiting for speech services, but there's a wait for all disciplines. Some children have now waited up to 11 months for services. The state law says that children must receive intervention within 30 days of their completion of their service plan. Both issues around service coordination and lack of providers in this community are a direct result of the dismal rates that we are given for our work. A temporary fix of the service coordination crisis is just trying to patch a gushing wound with a Band-Aid. We need a tourniquet at this point. The provider community is also concerned with the lack of communication from our legislators, the county executive, and the Monroe County Early Intervention Program about the measures that are being considered for a long-term solution. Other than the information that was shared at the press conference a couple weeks ago, providers are completely in the dark. Please include us as solutions are considered. Thank you.
Hello again. My name is Cynthia Tolman, and I'm here to speak on behalf of Early Intervention and Preschool Special Education Services in Monroe County. I'm a pediatric speech-language pathologist for more years than we're going to discuss, and I'm also the director of a local business that provides these support services to children in EI and preschool. I'm here to ask that money be reappropriated from one part of the budget to another in order to increase rates. Funding is desperately needed for service coordination positions so that additional staff can be hired. Additionally, increased funding is needed at the county level for preschool services. As I said last week, multiple surrounding counties all pay more for the speech, occupational and physical therapy than Monroe does, and yet all but one of them has a lower per capita income than Monroe. This lack of appropriate funding has a negative impact upon local businesses. We face the same challenges handling increasing costs that many businesses in our area do, but with cuts to funding. Rates have not been increased in decades, and it is becoming more and more difficult to attract and retain the workforce, professional workforce required to do this work. Despite a community rich in local universities, many new graduates choose to work elsewhere. And as a result, children are placed on waiting lists because of provider shortages. EI rates are set by the state, and yes, efforts need to continue there. But preschool-related services are, in part, set by the county. You can do something about the preschool rates in Monroe. Even an increase of $2 to $3, phased in over years, would be so beneficial. And if no action is taken by you, the children and families in Monroe will continue to be negatively impacted and placed on waiting lists due to a lack of providers. Thank you for your attention, and I hope for your help.
Hello, my name is Jamie Edwards. I'm a pediatric speech-language pathologist. I have 10 years experience. I've been working with children under 3 in the early intervention program in New York State for close to 8 years. I spoke at the last 3 meetings. While I'm somewhat relieved that the wait list has been withdrawn for new referrals, I'm still extremely concerned because of the low reimbursement rates. We are having a hard time keeping providers like myself in the field. There are many tasks that we do that are unpaid, one of which is mileage. Therapists do not get mileage reimbursement. When I covered the west side of the county without getting paid for mileage, I put approximately 400 miles on my car every month using the standard mileage rates, 54.5 cents per mile for business miles driven. That's $218 I should have been reimbursed per month. That's over $2,600 per year. Another reason we bill for extended visits, which is 60 minutes. However, we have to be in the house for greater than 60 minutes. So I have to bill for 61 or more minutes, even though technically it's just an hour visit. Furthermore, I have to do my notes in my car following the visit because I cannot do notes while I am treating or doing any parent training. Then I have to do progress notes every 6 months per child. If there's a change in the child's program, I need to document that. Also, I need to do a transition report 3 months prior to the child's 3rd birthday, all of which is unpaid. That is all in addition to daily notes that I have to take for each child. So I recognize that there's 2 issues here. Yes, the reassigning the county workers to do the unskilled portion of the service coordination job is helping with the wait list for the initial referrals. But what it's not helping is the wait list that we're seeing. And like Pia said, we have over 90 kids currently on the wait list because once they get evaluated, there's just no providers to see them because it's hard to attract new grads, and when we do get great providers, they end up leaving for more lucrative positions. There's only so long you can stay with a job without getting any kind of benefits or raises, so it makes it very challenging for qualified providers to stay with the job. So I am asking Yes, I am asking that you continue to work with Albany. I realize that this is a state issue, but we need your help. We need your voice. We need you to continue to advocate for us at Albany. We need the governor to speak up on this issue. Thank you.
Our next 3 speakers are Vanessa Stewart, Karen Spotton, and Sarah Ozimek.
Good evening, everybody. My name is Vanessa Stewart. I have a daughter who was pushed to the wait list. I live in Pittsford. Ariana was diagnosed with a hearing loss. Sorry if I get emotional. At 1 year old, she qualified for speech twice, 30 minutes, and a teacher of the deaf twice for 30 minutes. She was very withdrawn before services. She had difficult time relating and playing with others. Speech and TOD not only worked on her strategies to help her, but also helped us as a family to advocate for her in a variety of environments. When she was first diagnosed, Ari was blessed with two fabulous, amazing providers. They were experienced, they were qualified, and they loved what they did. They had a passion for what they did. Her TOD had a job. She had to get a job through the district because of financial reasons and personal reasons. She wasn't getting paid enough to support her children. And then the next TOD she had ended up leaving for financial reasons again 5 months later, which put us on the waiting list. She currently does not have a TOD, which in September going to preschool, this was devastating for her and for us. She went to school in September. Her teachers struggled to understand the importance of her hearing aids and her DM system. They viewed Ari as a normal child that can hear. They thought she didn't need her hearing aids, which was very frustrating for me, because on top of my job that I worked full time, I'm also going in, pushing in, and giving services, because I'm also a special ed teacher, but I do not know half as much as a TOD knows. So I'm learning as I go as well. It was wonderful that they don't label her or treat her differently. But think of all the strategies that Ari's missing out on to strengthen her skills and learn to advocate for herself. We continue to problem solve on our own, and our community helps us. Nazareth College with the Here to Succeed, and her speech provider is going out of her way and giving TOD services as well, as much as she can because of her passion. Thank God our community sees the importance of this crisis. These providers and our children need more support. If the reimbursement rate does not go up for our kids, we'll suffer. We need highly qualified teachers to work with our kids. It is not fair for teachers to feel like they have to leave because they can't make a living on what they love to do. This shortage is causing children like Ari, or children with more severe disabilities, sitting on a waiting list for services. While they sit, being unheard, they are getting frustrated, and I see this on a daily basis being a special education teacher. And they develop bad habits, challenging behaviors. When they enter the school system, they need more services because of this neglect.
Please
This
summarize.
will cost them even more. Invest money in EI, and it will save in the end. The earlier children receive services, the more likely they will not need in school age. Thank you so much for your time.
Hi, my name is Karen Spotten. I've been coming now for about 3 years. I have 34 years experience working in the Rochester City School District. The last 10 years of my tenure is being the preschool chairperson for special education for the city. You all know, and you should know, that this Birth to 5 is in crisis. You all know who's involved. You know the plight of the providers. You know that the 0 to 2 year old services have not had an increase in reimbursement rates in 20 years. In fact, they had a decrease. You know that there has not been an increase in the last 10 years for the 3 to 5 year services. You know, because last week I had a handout that should have gone to all legislators that was a chart that talked about who's responsible for reimbursement rates, setting rates and reimbursement. You know that the county supports some of this, and as well as the state. You now know that the surrounding counties have higher rates. You know that there's waiting lists. You know that it was just a Band-Aid by having the county executive do what she did to solve the problem. It essentially just provided clerical support to the special children's services in the Department of Public Health. So I guess the bottom line is this is the ask. We need a 30% increase in preschool rates. and that's for a 30-minute session. Needs to go from $52 a half an hour to $76 a half an hour. There's at least a 40% increase that's needed for early intervention, and those are for 60-minute sessions, and that means to go from $86 an hour to $147 an hour. Now, I know it's been mentioned that this sounds like a tremendous amount of money, but really when you figure out that this, if you have a 40-hour work week, like Jamie was saying before, only like 20 hours is billable, and this does not all go to the providers. So we need this money. We need it for our kids. I am giving the clerk a report that was done in April 2018 by Pete Nabosny of Children's Agenda, and it has all the research and everything is written here. I only have 3 copies, but I'm sure he can make copies for the whole legislature. Thank you. I appreciate your time.
Thank you.
Hi, my name is Sarah Alzemek, and I live in Pittsford. I am a parent of 2 hard-of-hearing children in early intervention, one of whom is now receiving preschool services. I am also the product of years of speech and hearing therapy services, as I was born profoundly deaf with no language whatsoever until I was first diagnosed and fitted with hearing aids at 2 years old. I know firsthand how much work it takes with a speech pathologist and a teacher of the deaf to learn how to listen and speak for long-term success. I also knew upon finding out my children's hearing loss diagnoses that I would do whatever I could to ensure the same support for them. I am so proud to say that my older daughter, who is deaf, is fully mainstreamed at her preschool. She is listening, talking, singing, and is a happy, well-adjusted child. Her work, as I can recall personally from my journey, is far from over, but all of her therapists have lovingly and expertly nurtured her listening and communication skills that she will carry with her for a lifetime. I cannot say one way or another that my younger son with the worst hearing loss will have the same experience, as he is currently receiving half the services my daughter received at the same age, and he's still on a waiting list for additional support. The system is failing my son and countless other children because there are very few providers left, as the pay is nowhere near sustainable. I am infinitely grateful for the services our providers are giving to my children. Without these amazing therapists, I would be completely lost in guiding them to their milestones, and I am not able to hear or pinpoint their progress the way that their professionally trained ears can. I'm here in support of keeping early intervention running locally rather than reassigning people as service coordinators with no training. As a parent, this issue is very important to me, and I hope the county does the right thing to work with Albany to keep giving our children opportunities to succeed instead of suffering the loss of quality providers due to low reimbursement rates. Several families I know personally have moved out of the county, out of state, and even out of the country to pursue services for their children elsewhere, a difficult decision that my family has also considered. Ultimately, investing in services for children at a young age, aka early, helps them to both meet and maintain their developmental milestones as they transition through childhood to adulthood, resulting in less expenditures overall. I encourage all of you to support what has been proven to be a successful program for so many children and families, and to please ensure its existence in the future. Thank you for your time.
Thank you.
This concludes the public forum.
Okay. The next item on the agenda is the approval of minutes. You have the minutes from the December 6, 2018 meeting before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Clerk.
Referral 18-0380.
Moved by Legislator Connolly, seconded by Legislator Draw. Is there any discussion? Legislator Morelli.
Thank you, Mr. Chairman. Through you to the administration, aside from partial funding for this full-time investigator, what is the funding used for on behalf of domestic violence survivors?
Chair, the only purpose of this grant is to partially fund the investigator in our office.
Okay, so through you, Mr. Chairman, the money is only for that purpose, so it's not going toward any domestic violence survivor programs?
Through the chair, the investigator works with the survivors and the victims, accompanying them through to court and to any kind of legal proceedings.
Okay, thank you.
Is there any further discussion? Seeing none, all those in favor, please indicate by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 18-0381.
Moved by Legislator Draw, seconded by Legislator Ansello. Is there any discussion? Seeing none, all those in favor, please indicate by saying aye. Any opposed? Item carries. Next item.
Referral 18-0382.
Moved by Legislator Ansello, seconded by President Carbone. Is there any discussion? Legislator Barat.
Thank you, Mr. Chair. Through you to the administration, from the prior public safety meeting, I know that we are going back to sign new contracts, contracts with the Irondequoit and Greece. My question is this essentially just going to be pass-through funding, or will Monroe County have any form of oversight or the time of the overtime or equipment expenses?
Through the chair, a little bit of oversight. They will have to upload their details into a database that I will be able to see. So I'll be able to see, what overtime they did work, and I'll be able to verify that they did work it. And the Border Patrol also oversees the program. So if that explains it a little.
Yes, it does. Thank you very much.
Okay. Is there any further discussion? Seeing none, all those in favor, please indicate by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 18-0383.
Moved by President Carbone, seconded by Legislator Connolly. Is there any discussion? Seeing none, all those in favor, please indicate by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 18-0384.
Moved by Legislator Connolly, seconded by Legislator Draw. Is there any discussion? Seeing none, all those in favor, please indicate by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 18-0385.
Moved by Legislator Draw, seconded by Legislator Ansello. Legislator Barat.
Thank you, Mr. Chair. Through you to the administration, who handled the auction?
Through the chair, it was Roy Tellworth Incorporation.
Thank you. And through the chair of the administration, and I assume that the Roy Tellworth Corporation handles all auctions, all the county's auctions. Is that correct, through the chair?
Through the chair, that's correct.
Thank you.
Okay. Is there any further discussion? Seeing none, all those in favor, please indicate by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 18-0386.
Moved by Legislator Ansello, seconded by President Carbone. Is there any discussion? Seeing none, all those in favor, please indicate by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 18-0387.
Moved by President Carbone, seconded by Legislator Connolly. Legislator Barat.
Thank you, Mr. Chair. Through you to the administration, the referral states that this is the 5th time we've received this grant. What did we receive in the last year, or the last grant contract, through the chair?
Through the chair, as I explained earlier, the state interoperability communications grants, rounds 4 and 5, are used to erect the 4 new towers that we are putting up to enhance the trunked radio system.
Yeah.
Round 6 is intended to be used for in-vehicle repeaters for people that go on the scene, for the communications on scene. And this is round 7, and what that will be used for is connectivity to the sites, probably fiber, to provide a reliable pathway.
Thank you. So through the chair of the administration, so in round 7, we've received approximately $1.6 million.
Through the chair, that's correct.
Thank you. Through the chair of the administration, could you tell me what we received in round 6?
Through the chair, 1.727572
1.727572?
million. Yeah.
Yes,
1
okay.
million, right.
Thank you very much.
Okay. Is there any further discussion? Seeing none, all those in favor, please indicate by saying aye. Any opposed? Item carries. Next item.
Referral 18-0388.
Moved by legislator Connolly, seconded by legislator Draw. Legislator Draw.
Thank you, Mr. Chairman, and I apologize if this question was asked before in the previous Public Safety Committee. Through you, Mr. Chairman, so what's the reason for the almost $99,845 decrease in this grant? Increase.
Through the chair, we've received this grant for several years, and it does fluctuate from year to year when we receive these federal grants. The federal government doesn't tell us why, but it is a formula grant based on crime statistics as well, so that could be part of the reason for the increase.
Is that through you, Mr. Chairman? So, in a sense, some of the backlog would have to do with that, besides to clean up some of the backlog, maybe?
Through the chair, like I said, the grant does fluctuate from year to year based on available funding for the federal government and also the formula they use to determine what each state is going to receive.
Thank you.
Legislator Baroth.
Thank you, Mr. Chair. Through you to the administration to follow up, you stated that federal funding varies from year to year, and then it's also based upon a formula. Would you say that this 44% increase is due to a substantial increase in available funding? Through the chair.
Through the chair, yes, that is part of it.
Thank you. So less to do with changes in our the factors that go into the formula, correct? Through the chair?
Through the chair, yes.
Thank you. And then finally, through the chair of the administration, what is our current backlog?
Through the chair, our current backlog in the DNA section is 660 cases.
Thank you. Through the chair of the administration, is that an increase or a decrease over the past year? So a year ago?
Through the chair, it has increased due to the mandated submission of all sexual assault kits from law enforcement agencies.
Thank you.
Is there any further discussion? Seeing none, all those in favor, please indicate by saying aye. Any opposed? Item carries. Next item.
Referral 18-0389.
Moved by legislator Draw, seconded by legislator Ansello. Is there any discussion? Legislator Morelli.
Thank you, Mr. Chairman. Through you to the administration, I know that we do this agreement every year, but is the amount of the contracts going up from year to year, or is it staying relatively flat?
Through the chair, this year it is decreasing by approximately $77,000. That decrease is due to one county opting out of our services and a reduction in submissions by 2 other counties, which reduce their costs.
Through you to the administration, in terms of the counties that we are regularly working with and who haven't decreased the number of submissions that they are sending to us, have these contracts gone up or remained the same?
Through the chair, they have tended to go upwards, but again, part of that has to do with the increase in submissions with some of the counties.
Through you to the administration, I guess then in the per case or per submission? Is it going? Has this is the cost increased?
Through the chair, the formulas we do use to determine these costs are based on a 3-year average of case submissions, and our costs do tend to go up year to year, whether that's costs and supplies and personnel would also be factored into those costs that are incurred by the laboratory.
So through you to the administration, then, in that case, we are recouping even if it costs Monroe County more to process these cases, we are in turn collecting more. Is that correct?
Through the chair, yes.
Okay. Thank you very much.
Is there any further discussion? Seeing none, all those in favor, please indicate by saying aye. Any opposed? Item carries. Next item.
Referral 18-0390.
Moved by Legislator Ansello, seconded by President Carbone. Is there any discussion? Seeing none, all those in favor, please indicate by saying aye. Any opposed? Item carries. Next item.
Referral 18-0391.
Moved by President Carbone, seconded by Legislator Connolly. Legislator Barat.
Thank you, Mr. Chair. Through you to the administration, first, I just want to say thank you for applying for this grant from the University of Baltimore. I think it's a wonderful pilot that we're going to be hopefully receiving the benefits from. I have a few questions. One is we're receiving $262,500 and contracting for $190,000. Am I correct to assume that the remaining $72,500 is going to be for oversight? That's going to go to the Sheriff's Department through the chair?
Through the chair, we are also going to be contracting with a research, probably a university, to do oversight of the program and to see if it works or doesn't work. Some of that funding will go to them, and then some of it is for rehabbing the pods that the inmates from the MAT unit will be in. For like paint, we will have a program area, so we'll have some screens in there so they can show them videos and stuff, and some educational material as well.
So through the chair of the administration, just so I understand, the $72,000 is going to be used for rehabbing the pods, education materials, and did you say a contract with the University of Baltimore through the chair?
To the chair, no, a local university. We'll be sending it out to St. John Fisher, RIT, U of R, and we'll have to do an RFQ. And that amount will be $32,000. It's 15% of the award for the research side of it. And then the rest of that 70 will be for the sheriff's office.
Thank you. And through the chair of the administration, will that, the results of the RFQ, as well as the rehabbing of the pods and the other expenses, come back before this body, or no?
Through the chair, just the contract with the university.
Okay, thank you. And then finally, through the chair of the administration, well, not finally, this is the first time the University of Baltimore has done this grant, and it will end in approximately 1 year. Is this something that we expect we can reapply for a stage 2 grant, or is it we don't know what's going to happen in terms of funding, or have no ideas about funding past December 31st, 2019, through the chair?
Through the chair, with my research with this funding, it appears they have funded similar programs like this through the country. And there is a possibility to seek other funding, probably based on our performance and whether the program works or not.
Thank you. And then finally, through the chair, it was stated that a request for proposal was issued and that Prime Care Medical of New York was selected as most qualified. Were there any other local respondents? I'm assuming this one's local, or is it not?
Through the chair, that was through our annual RFP process for a medical provider, because they are currently in the jail and have a contract for 3 years.
Mm-hmm.
We have to use them.
That makes sense. Okay, thank you very much.
Okay. Legislator Mafucci.
Thank you, Mr. Chairman. Through you to the administration. Obviously, this is a grant. It's not federal. It's not state. So where is the income? How was the income considered?
Through the chair, it is actually, I think, funded, because we're a sub-award with the University of Baltimore, so it is federal.
Federal
National
grant.
Center for Drug Control, I think, is what the federal agency is.
Thank you very much. I appreciate it.
Okay. Is there any further discussion? Legislator Connolly.
Mr. Chairman, through you to the administration, what is the evidence-based medical assistance? Is it a Suboxone or a methadone?
Through the chair, it's all of those. It also could be a methadone clinic.
Thank you. And through the chair to the administration, do we have a sense of how many inmates will be helped during the year that the grant is in place?
Through the chair, we really don't know because it is a pilot project. We're going to have 50 male beds and 50 female beds, and based on the funding, we're going to see how many people we can help and assist.
Thank you. And through the chair to the administration, does the money in this grant cover the cost of the medication, or will the medication be provided by Medicaid? Or
Through the chair, while they are incarcerated, yes. When they get out, that's why we were going to have a case manager to follow up for, get them Medicare, so when they get released from the facility, we can continue that MAT treatment program.
Thank you.
Okay. Is there any further discussion? Seeing none, all those in favor, please indicate by saying aye. Any opposed? Item carries. Are there any other matters to come before this committee? Okay, seeing none. There being no other matters, the December 18th, 2018 meeting of the Ways and Means Committee stands adjourned. The next meeting of the Ways and Means Committee will be held on Tuesday, January 15th, 2019 at 6 p.m.